Hi, it's Santa, and here's my video blog, and I wanted to give you a little update. I'm letting you know about my surgery. You may not have known this, but I have a crossed eye. I have strabismus. See that? And they're going to do surgery tomorrow. They're going to fix my eye and make it straight. And what I'm going to do is I'm going to share all of the progress and everything with you in this little video. So wish me luck, and I'll talk to you soon. Bye. Hi, here I am, day of surgery. Okay, I had the surgery about 5 hours ago, so I'm back home at the Clary's house. Had surgery at about somewhere around 1, and it's about 6 o'clock p.m. My eye's sore. It's sore. It kind of feels like it's tearing up. And the surgery, the doctor said it went well. It was a little bit different than he had anticipated. At this point, though, what we do is we wait. I go into the office, at the doctor's office at 7 o'clock tomorrow morning. He will remove the patch and we'll see the results. So here we are. Excited about it. Well, here we are. It's November 1st of 2012. Just got back from the doctor's appointment after my eye surgery. So far, it's been about 21, 22 hours since the surgery. You can see, the eye's still plenty bloodshot in the middle, in this area in the inside here, but the eye's much straighter. Did a great job. He told me that there's a high likelihood that the eye might even improve further over the course of the next upcoming days here. So the alignment right now doesn't look 100% perfect to me right now, but obviously it's a much better than it was. The pain. It's so funny, but it just was not that big of a deal. There was certainly a little bit inconvenience in the hours immediately. There was a couple hours immediately following the surgery where I felt fine, just was no problem at all. Then there were a few hours in there that was a little bit more painful, and especially when I turned my eyes from side to side, looked to one side or another. Then even though I had a patch on, it was a bit painful underneath that. And then this morning, I went to bed early, about 9:30, and slept reasonably good throughout the night. Woke up this morning feeling much better. Went to see the doctor this morning. He examined it all, said it looked great. He was very happy. He had said he let the eye out as far as it could. That inside muscle was moved back now as far as it can be moved back. And if it was necessary to make a further adjustment, he can make that on the outside muscle by pulling that a little bit closer and to bring it into perfect alignment, which we would do if necessary 6 months or so from now. Anyway, but that's the update. I feel great, and if you're having any thoughts about having a strabismus surgery, I would say definitely do it. It's not nearly as difficult as you might be thinking that it is. I was very hesitant, and now I would do another one in a heartbeat. Anyway, talk to you later. Hi, it's Sunday, and it's November 4th. Back home, got a great night's sleep. Great to be back in my own bed after about 8 weeks of being gone. It just feels good to be home. And the eye's doing good. So, the eye's, still bloodshot. But feels good and just coming along. Again, surgery was on Halloween, which was on October 31st. That was Wednesday. Today's Sunday. So we only had a few days here, but it's come along very nicely. The 4th day after the surgery. I know my eyes are so small you can't see it great, but you can kind of get an idea there. So very good. All right. Until next time. Talk to you then. But here we are. It's Wednesday, November 7th, 1 week after the surgery. Let me show you the eye so you can see the redness is beginning to clear up pretty well. The eye is still not absolutely straight. So, you can see that the eyes are not perfectly aligned, and the doctor did say that he had let out the eye as far as he could go from the inside, and he might need to pull the outside back a little bit just to get perfect alignment. We might need to do that in a second surgery, or this still might adjust a little bit in the next week or so. So we'll keep an eye on that. But anyway, there it is. So, all right, there it is. Talk to you later. Bye. Hey, here we are, day 14, 2 weeks after the surgery, and all's good. Let me show you the eye real quick. You can see still a little red on the inside there, but for the most part, just great. You can see if I try to look straight into the camera, you can see that the eye's still a little bit crooked. If I look over and I follow my finger, kind of see how I do. So the eye's still pointed in just slightly. As the redness clears up on the inside, I'm hoping that it looks like it's a little bit further out, but we'll see. It might be straightening out a little bit as we go along. So that's it for now. Talk to you next time. Hi, it's Santa, and here we are, 8 months after the surgery. Let me show you my eyes. I just went in and talked to the doctor, Dr. Wright, and he said everything was great. My eyes are in normal tolerance, and you can certainly see that they are. I am just so thrilled about the surgery, and I just want to say that if you are considering the surgery, I just would so strongly recommend it. It's changed my life. I feel so much better having my eyes now perfectly aligned. And if you can help, and this is the other thing I wanted to ask, Dr. Wright, Dr. Ken Wright in Los Angeles, he's a great surgeon, and you would love to use him. If you live anywhere in the area of Los Angeles or anywhere else, it's worth traveling to him. He's just absolutely terrific. But he also has a foundation called the Wright Foundation, and he helps provide these surgeries, these life-changing surgeries to youngsters whose family can't afford the surgery. And if you can help, if you can donate to the Wright Foundation, oh, that would be such a great gift. So join me, join Santa Claus, help the Wright Foundation, help children all around the country and all around the world to get this life-changing strabismus surgery, this lazy eye surgery to help straighten our eyes. You know what that can do for self-esteem and how beneficial that can be for children. So please, if you possibly can, any little bit helps. So join me, be a gift giver. And I'll hope to talk with you soon. And remember, keep the Christmas spirit alive all year long.